How many times have you been told that your shoulder pain is due to impingement? The term impingement is extremely vague and it doesn't actually tell you what's going on with the shoulder. So that's what I'm going to cover in today's video. What does shoulder impingement actually mean? First, let's cover a little anatomy to give you a better understanding about this injury. Your shoulder is made up of three bones: the upper arm bone, your humerus, the shoulder blade, your scapula, and the collarbone, your clavicle. Your arm is kept in balance by the rotator cuff muscles. These muscles and tendons form a covering around the head of the humerus and attach into the shoulder blade. There is a lubricating sac called a bursa between the rotator cuff and the bone on top of your shoulder, which is called your acromion. The bursa allows the rotator cuff tendons to glide freely when you move your arm. So essentially, shoulder impingement is a clinical syndrome in which the soft tissue becomes painfully entrapped in the shoulder joint. On a pathophysiological level, it can have various functional, degenerative, and mechanical causes. So let's dive a little bit deeper into what this actually means. So we have two types of shoulder impingement. One is the external and one is internal shoulder impingement. The most common type is external shoulder impingement, and this is also known as subacromial impingement syndrome, which has primary and secondary forms. The primary impingement is due to structural changes which create mechanical narrowing of the subacromial space. This is often due to bony narrowing or fracture or bony overgrowth, which can create subacromial bursitis or calcification of the tendon, often the supraspinatus tendon. And then secondary impingement can be from functional disturbances of the humeral head, mostly because of muscular imbalances, which is usually majority of the cases that we see with shoulder impingement. This issue is often mobility, stability, or coordination of the shoulder joint, leading to pinching of the structures in and around the shoulder girdle. Mobility issues would be like the lats and the pec muscles because their function is to increase internal rotation of the shoulder joint. And then stability issues we'll often see with the rotator cuff muscles, the posterior delt, rhomboids, and lower traps, because these muscles might be weak and not stabilizing the shoulder joint in position. So who's at risk for shoulder impingement syndrome? Well, it's common in all ages, but generally it affects individuals that are 40 or above who perform repetitive overhead movements, and athletes with sports that require a lot of overhead motion, such as swimming, tennis, or volleyball. The most common symptoms of shoulder impingement include pain is usually persistent between 70 and 100 degrees. We also call this the painful arc. Pain is usually gradual unless it coincides with a trauma. You may have weakness and or numbness that radiates from the shoulder down into the arm. This can be because one of the nerves is compromised. Complaints of neck pain is also very common because of the soft tissue that attaches to the shoulder blade as well as the spine. You may complain of difficulty sleeping on that side, and you may have difficulty performing daily tasks such as placing your arm behind your back to button or zip up clothing. So now the mobility and strength exercises. The goal of the treatment is to restore mobility and improve stability of the shoulder joint. So let's jump into the stretches first. As I mentioned before, the lats and the pecs tends to be the muscles that are tight that increase internal rotation of the shoulder. So what we want to do is reverse that. We want to increase external rotation of the shoulder, so we need to work on flexibility of these muscles. So we'll first start with the lats. So using a cable machine, grab onto the handle, place the palm up. This allows for external rotation of the shoulder joint. Then you're going to place your other hand on top of that hand and lean back. Make sure that the cable is fully loaded. Then hold the stretch for 30 seconds. Focus on your breathing. Inhale, exhale will help expand the rib cage, which will also help to lengthen and stretch the lat. Then switch, do the opposite side. So you want to alternate between left and right. Do 3 sets of 30 seconds. Second exercise is a soft tissue mobilization of the lats. Grab a ball, either a tennis ball or a spiky ball for this one. Place the ball against the wall. Place it against your lat with your arm extended overhead. Find the spots that are tight and try gently rolling around that area. We can create a pin and stretch while moving the arm up and down to help separate the different layers of the tissue. Do this for 2 minutes, and this can be done multiple times per day. The third one is a soft tissue release of the pec muscle. If your shoulder injury is pretty acute, I would suggest you start with lying on the floor. This way you're not fighting gravity. So first we'll start with leaning against the wall. So you want to grab the tennis ball and you actually want to place it, if you can see here, you want to make sure the ball is placed right in this area here. Not too high, so it needs to be underneath the collarbone, and it can't be too far out to the side, but just through this area here. So you can roll that ball all around this area. You're going to place the ball against the wall, and then you're going to lean into the ball, creating that compression in this region. Then I want you to have your arm extended and elevated out to the side. Slowly elevate the hand overhead towards the ceiling, and then slowly control it back down. So as you can see, if your shoulder is still really acute and you have pain during that 70 to 100 degrees of shoulder range of motion, then this might be still a bit too sore to do. So you can try this one against the floor, so that way you can actually have a little bit more support when you're doing the movement. This one you can do for about 10 to 20 seconds. Give yourself a little bit of a break. break in between, switch and do the opposite side. This is actually a great exercise to do anyways, just to improve overall posture. So those are the two muscles that I would focus on working on your flexibility and mobility. Now we need to work on the stability and strength. So we're going to target the rotator cuff muscles, your lower traps, posterior delt, and rhomboid muscles. The first exercise is going to be prone tees. So you need a bench. You're going to lie on the bench with your chin just touching the edge of the bench just to support your neck. And if the shoulder's pretty acute, then we can just start without any weight. But then I would suggest starting with a really light dumbbell, either 2 to 5 pounds. Bring your arm out to the side, palm facing down to the ground. Keep the elbow extended as you elevate the arm out to the side, squeezing the arm and shoulder blade back. You want to perform 2 sets of 10 reps, holding for about 5 seconds. The holding is key because we're not just working strength. Because remember, strength is your ability to produce force, and stability is your ability to limit excessive or unwanted motion. This is key. And the second exercise we're going to do is a kneeling row with external rotation. And we can add a press in there too. Now, kneeling, place a TheraBand around the cable machine or use a door anchor to perform this movement at home. Make sure you have tension on the band to start. Then extend your arm out in front of you, parallel to the floor. Set your shoulder blade by retracting the shoulder back. Then slowly pull the elbow back towards the side of your body and externally rotate the shoulder by lifting the hand towards the ceiling. Hold for 5 seconds and slowly reverse the movement. Do 2 sets of 10 reps and 5 seconds of holding of this one as well. Once this one starts to get easier, you can increase the weight or the resistance of the band, and then you can also build up to 3 sets. And then another progression with this one is once it starts to get a little bit easier, you can challenge the shoulder by externally rotating, then pressing up towards the ceiling and holding it for 5 seconds. Now, these two are very challenging stability exercises for the shoulder blade. There are other exercises that you can do as well, but the premise of these exercises is that you need to work on external rotation of the shoulder joint and work on the stability, not just the strength. Now, for the exercise equipment that I used in this video, I'll make sure to link it down in the description below. So here are the takeaways from today. The shoulder joint is very complex. It's crucial that you first get an assessment to figure out what exactly is going on with your shoulder. Everybody is different, and the onset of this injury can be because of a limitation or a compensation that was created before. As I mentioned, it's not as common to have a direct trauma for this injury. It's usually repetitive or an overuse injury, so we need to kind of figure out why this has happened in the first place. So these exercises are a guide to assist you along your recovery. The premise is to focus on, again, the mobility and flexibility of your pec and lats, and then work on strength and stability of your rhomboids, your rotator cuff muscles, lower traps, and your posterior delt. Be consistent with your exercises daily, and I hope this video was helpful, and I'll catch you in the next one.